Hey folks, Kevin here. Well, it's December 21st, 2021, and today I'm going to be talking about booster vaccinations or vaccinations. And so you may not want to listen to this video, but this is some information that I've been sharing with some of my loved ones, and I thought I'd make a quick video. Make a video about this topic. So background on me, I'm retired now, but in my profession, a veterinarian, internal medicine specialist. So I got to see patients that were recommended to come and see a specialist from the general practitioner to come and see me for whatever disease process there was. I dealt with internal medicine cases and critically ill patients as well. So throughout my practice years, occasionally I would write in the medical records and advise the clients and the referring veterinarians potentially not to provoke the patient's immune system by giving them further vaccinations. This is often when dogs and cats were older. They'd already received all their vaccinations early on in life, and the reason that I was making this recommendation was solely because those patients had demonstrated that their immune system was targeting themselves. So they were hospitalized and given blood transfusions or some other extreme interventions to help restore good quality of life. So these were severe adverse reactions to something that provoked the immune system. It may not have been a vaccination that triggered it, but because their immune system, their military, designed to protect them against outside forces, bacteria and viruses or whatever, wasn't seeing the enemy, it was seeing self and attacking self. So, and that was really a minority of cases, but as a specialist, I would see those cases upon admittance to the hospital and all. So, with this information, people would often ask, well, what do you think about me getting the vaccination for this? These are brand new vaccinations and all. And I made videos in the past talking about Thea, who's also a veterinarian. She's retiring after next week. We have already received our initial and the first booster, and now we're scheduled for the next week, not the week that we're in right now, to get our follow-up boosters. So we'll have been vaccinated 3 times for the virus causing the pandemic. I do think that that's really wise, and that's what I've been telling my loved ones and all. So I think that's really important to do, especially with the new with the developments of the new messenger RNA type vaccinations that have been developed. They are extremely safe, in my opinion, based on knowing the gradual evolution of vaccine development over the years. Now, vaccines have always been very important. They've really saved so many lives, but there are instances where people have had adverse reactions. I think there'll be some more publications. I'll put a link in the description below to Dr. John Campbell. He's from Europe, and he's talked about one of the things that I'm going to be sharing with you at this point about how we aren't following our standards of care in the United States as far as administering vaccinations aren't, in my opinion, what they should be. So back years ago when I was trained, even before I was trained in veterinary medicine, I learned about using syringes and needles. So this is an example of a syringe, and it consists of a tube where the liquid media that will be injected into the patient, and a piston here that where the administrator will draw up into a vial, and here's another syringe inside of a case as well. So this comes pre-packaged with a needle attached to this syringe, and the thing I want to talk about is I should stop this for a moment and just give some further background. So when we're talking about giving injections, we want to have the vehicle that we're delivering the medication get to the source that is the most important source. So when we're giving injections in human medicine, we think of intravenously or intramuscularly. Those are the two common ones. Of course, there are intradermal. The dermatologists would do skin samplings, testing, giving intradermal. These are tiny little needles going just so deep to stay within the skin. In veterinary medicine, we'll give injections subcutaneously. That's underneath the skin, not done as commonly in humans. But when we're giving a vaccination, now in veterinary medicine as well as other forms, we can give vaccinations intranasally as well. But for the most part, when we're talking about modern vaccinations, especially having to do with what we're dealing with right now, it's given intramuscularly. And there's a reason why it's given intramuscular as opposed to intravenously. Some things we want to give intravenously, and I'm not going to get into those sorts of things. The reason that we want to give a vaccination intramuscularly is because by giving it into the muscle group, it's going to be drained from that system by the lymphatic system. So it's really important that it doesn't get into the vascular compartment, the venous system, the veins. So we have arteries going to the tissue, we have veins draining from the tissue, but there's more hydrostatic pressure going into the muscle in the artery than there is pressure in the venous return. So there's an excess of fluid going into the muscle that gets drained into our lymphatic system. Our lymphatic system is part of our circulatory system, and it's a major part of our immune system. Our lymphatic system that drains from the deltoid muscle, where we're being given these vaccinations at this point, get drained into our lymphatic system, and so we might feel lymph nodes feeling a little bit swollen or enlarged as a result of the administration of that vaccination. That's an appropriate and reaction, and it's a positive reaction. So by giving an injection into the muscle, we're using the lymphatic system where there's specialized cells called antigen-presenting cells, and there's the rest of our immune cells that take and they process the messenger RNA particles that are being administered to the immune system, and they're processing it appropriately, as opposed to if these vaccinations are given intravenously, that can stimulate immune cells in our heart, in our liver, in our kidneys, those organs that where our circulatory system flows through all the time. Yes, our muscles do have a circulatory system going to our deltoid muscle, but they're very tiny vessels called the capillaries, and therefore it's difficult to get much of the injection into those capillaries. Most of it will go into, if administered properly, will go into the lymphatic system, get drained in, get processed through our lymph nodes, and then get circulated after it's been processed through our venous system and then around the rest of our body. So there are reports of adverse reactions with young males, with other people who have had an immediate sensation like tasting an odd taste within a few seconds after being administered the vaccination, and then having a whole cascade of different side effects from the vaccine. And I think part of the reason is because we are not following a simple standard that was set years ago, at least in veterinary medicine, where when the vaccination is being administered, first the person doing the administration will take a vial, they'll aspirate, suck the contents of the vaccine up into the syringe, and now it's in the syringe and it has the needle on it. And then when it's going to be administered into the muscle group, being put into the deltoid muscle, often we see, and you can see in the videos now, the administrator will just go ahead and inject it. Although it's extremely unlikely, there is a possibility that the tip of the needle, the orifice that opens, could be in a vein. And if that were the case, if the person before administering the vaccine went ahead and aspirated, and aspiration just means pulling back on the piston, this part here, and looking for any red in the hub, which would indicate that the end of the needle is in a blood vessel, and pulling back on the piston of the syringe or aspirating. If they don't see anything, they just get negative pressure and they only see like a tiny little air bubble or whatever there, then they know that they're not in a vein, and they can go ahead and administer the vaccine into the muscle group, and then the venous system, the lymphatic system can take that liquid that has been administered into the muscle group and gradually drain that into the lymphatic system, decreasing the chances of the vaccine being inadvertently, by accident, getting delivered into a vein, which there's probably a greater incidence. In other countries, they still require the administrator to aspirate the piston. That isn't being taught this day and age. So the standard of care is to just in the United States at this point, the standard of care is to just put the needle into the deltoid muscle and press the piston without checking to see, by aspirating the syringe or pulling back on the piston of the syringe, to be certain that we aren't in a blood vessel. The other thing, for those of us that are really overweight, and this is our culture nowadays, there's so many of us that are overweight, and I was very obese. So if you do imaging studies of using advanced, CT, MRIs and all, we'll see that there's actually a fat layer underneath our skin layer before we get to the muscle. The other thing that can happen is that when someone grabs a hold and pinches the muscle group, they can be bulging up the amount of fat that's underneath the skin, and the injection could be delivered to fatty tissue. So by not pinching and by aspirating before delivery of the vaccine, I think that would be potentially a wise thing to do. So that's one of the things I'll do. Now, Thea and I are not really overweight at this point, so if the person grabs a hold of the muscle, that's okay. When you have very small muscle mass, if you're very thin, that may be something to do. In veterinary medicine, when I was giving injections to a hind limb from behind a dog, I'd always put my thumb in between two muscle groups, semi-mem, semi-tens, and put my thumb there so that I would not inject in the area where the thumb was, because you could deliver an injection into the sciatic nerve. So knowing the anatomy, where the arteries, the veins, and the nerves are located, understanding the anatomy, we can try and deliver it into the best place. This is, I don't want to call it a no-brainer, but the deltoid muscle, like the buttocks, are two locations that there's nothing but muscle right there. As long as you don't use too long of a needle for someone who's who's slender and doesn't have a lot of muscle mass there. As long as you aspirate to make sure the tip of the needle isn't in a vessel, you're in good shape. And if you're really overweight and they pinch up on it, it could go into the fat, the subcutaneous fat, as opposed to actually being long enough to get into the muscle group itself. So the goal of this vaccination is to be delivered to a muscle so that the lymphatic tissue can drain that muscle and present those constituents within the vaccine to the antigen presenting cells that can process that before it gets into our circulatory system and prime our immune system and develop memory cells and the ability to produce antibodies against the offending organisms and not against ourselves. If it gets into our blood vessels, there are adverse reactions that can happen, as a result of that. So that's just something to be aware of. I am, again, a big proponent of getting vaccinations. The more that people are vaccinated, the less likely. Now, of course, with this most recent variant, it replicates so much more quickly once it gets into our bodies, and it can get spread much more quickly, going from person to person to person than ever before now. Fortunately, this is not a more deadly one from everything that the data that we've gotten so far. But two things, I do recommend asking that the person who's administering the vaccination pull back on the piston of the syringe once they've inserted the needle into the muscle group, just to make sure that there's no blood. If blood comes up, they just change the needle, reinsert into a different spot in the muscle, re-aspirate again and make sure there isn't any blood there, then deliver the vaccine. So those are my thoughts on the vaccine. I'll try to remember to put a link to one of John Campbell's videos. They're often very good. He gives regular updates on the virus that's affecting us all. So I hope you all stay safe and have a wonderful holiday season. Thanks for watching and have a great day. Bye-bye now.